We can and must tackle Mpox together, across regions and continents. How we respond now and in the years to come will prove a critical test for Europe and the world.
Officials from the World Health Organization are calling for the global coordination in helping to control the ongoing spread of Mpox. The WHO stressing that Mpox is not the new COVID, but cases continue to grow at a concerning pace in Africa, with the continent's Centers for Disease Control saying Congo recorded more than 1,000 of over 1,400 new Mpox cases reported in the continent over the last week.
It's really a whole logistics chain, from our acceptance first and then a few administrative procedures before shipment. But our strategic vaccination response plan is already ready. We're just waiting for the vaccines to arrive.
Congo is expecting to receive the first arrival of doses as early as next week. Mpox outbreaks in Africa was recently declared a global emergency by the WHO. Oxfam International is among the organizations involved in distributing vaccines and is calling for patent sharing to help developing countries.
It's all about money and profit, and there's no money or profit in the developing world, and particularly in Africa, which is why you need a system, which is what the World Health Organization has called for, where vaccine technology is shared all over the world.
Adding to the concern, health officials around the world are monitoring a new, faster spreading variant. In Argentina, authorities have quarantined a cargo ship in the Parana River over a suspected case of Mpox on board.
So far, the entire crew was checked, and so far only one person had compatible lesions. Therefore, a sample was taken from those lesions.
Argentinian officials say there is currently no record of any case of the Clade 1 variant. Other Latin American countries, though, have put surveillance measures in place. Here in Canada, 164 Mpox cases have been recorded so far this year. To date, no cases of Clade 1 have been identified in the country. A 2022 global outbreak of the Mpox Clade 2 strain was largely ended by vaccines and treatments made available in rich countries, but hardly any doses reached Africa.
So will we choose to put the systems in place to control and eliminate Mpox globally, or we will enter another cycle of panic and neglect?
Bavarian Nordic, the Danish company that makes the vaccine, has donated 40,000 doses to Africa's public health body, while the European Commission said the EU would be sending 215,000 doses from stockpiles to Africa. However, there is so far no date for delivery. Afia Boss, City News.